the Function with Purpose podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 10, Episode 1 of the Function with Purpose podcast. Dr. Amy is in with you today. Thank you for tuning in. Oh my gosh, 10 seasons. Every season has 8 episodes. And approaching episode 1 of Season 10, just going to kind of change things up a little bit. These are going to be just a little bit longer, and I'm probably going to expose 1 episode per month, because my energy is going to be focused elsewhere, actually more towards the Fortress Physical Therapy YouTube channel. And if you're not a subscriber to the YouTube channel, I will hyperlink it in the comments below. Definitely subscribe. I'm starting to put out more content there for education for the public and for yourself. But, all right. Thanks again for joining in. If you haven't noticed already, these recordings, at least the recent ones, towards the latter portion of Season 9 and getting into the current season, I upgraded my mic, finally. So shout out to Dr. Zach Long with Barbell Physio. I appreciate it. This mic was worth it, and I'm loving it. It is so tiny. It's like the size of 2 quarters put together lengthwise, and then it's probably maybe like a ½ inch thick. I can literally just put it in my pocket and take it around with me. So pretty cool. I'm glad I upgraded. Thanks again, Dr. Zach. All right. First episode of Season 10. I've had a recent interaction with a patient. Obviously, I like to tell stories in order to come up with this kind of title with today's episode, because twice now, actually, she experienced the same issue and thought that, honestly, the mindset, unfortunately, her mindset during the second bout of injury or setback, that she thought she could kind of still just rest the area and she would be fine when she would return to CrossFit or exercise class. So today's title, How to Thoughtfully Respond to a Body's Warning Signal. So the human body, as we know, and if you didn't know, is very, very complex, especially when it comes to interpretation of pain. Pain, honestly, when it comes down to it, I'm going to try to dim it down, is a more so, I guess, good thing in my eyes, a good thing rather than a bad thing. Why? Because the body's pain system or perception of pain or experience of pain is actually a protective mechanism. So it helps protect us from further going down that path of even more pain, air quotes, right? Or making things worse. So it kind of puts a stop to things, makes us kind of step back and realize, okay, something is not right, something feels wrong, and should I continue doing what I'm doing? So kind of setting that, I guess, in clay right now. So the body's pain signal or the pain system is a good thing. It is the body's warning signal, essentially, right? It protects you from pushing through unwanted or improbable barriers, right? It just makes us stop and think. However, getting towards today's title, how to kind of thoughtfully respond to the body's warning signal or pain signal, I think there's kind of two types of individuals I kind of encounter. The first is the rookie, I guess, individual, right? Someone who, I guess, sustains a setback or an injury or a pain signal for the first time, and they have no idea, like, what that even means. Everything is new to them. They've never experienced this issue before. And I think for today's example, I'm going to use the shoulder complex, because this leads into my patient case. So there's the rookie individual who experiences something for the first time, and then there's the seasoned individual who has had a previous experience, knew and felt what this experience produced, therefore they recall what has worked in the past that made it better. So they're able to kind of get into, I guess, a self-exploration rehab protocol for themselves, because they remember what happened in the past. They remembered what worked, so they're going to instill those practices again and perhaps make them stick around more so for the long term, rather than things just popping up and then going back to those standards that they recalled from the past. So there's like two types of individuals that I kind of dump people into these categories. In this particular story I'm going to tell you, I still kind of consider this individual as a rookie. So I had a patient who reached out a while back, just passing through the CrossFit classes, because in between my patient care, I'll kind of go out onto the main floor because my office is located right on the main CrossFit floor when classes are going around and they're happening. So this patient was getting ready, coming in before class, maybe like 10 minutes before class, and this was like 10 minutes before I saw a patient. So I was out kind of mingling on the floor, and then she kind of came over and started a conversation. She's like, "Hey, Amy, my shoulder is just starting to flare again, but, I'm taking it easy, I'm resting it, and I'm just trying to not do any pull-ups on the pull-up bar. Or any rotation type movements, i.e. the barbell snatch, or quick, what we call those rotator external rotation positions. So think of a baseball pitcher or a thrower. They get ready to cock their arm back into that external rotation. And then really, she kind of dropped some other hints that, outside of class, she's not really doing anything to help, I guess, like, bridge the gap between the next class that she attends, so i.e. rehab, right? Although we've taught her things in the past, I think she just kind of like forgot and thought, hey, rest. Let me just rest this. And then it's just going to get better when I do another pull-up. Time passed, and it was maybe like another 4 weeks later, she reached out to me via text message and was like, hey, I think I need to get on your schedule. This is not going away. I just thought literally just resting it and avoiding the movements that aggravate it is going to make it better. So when she came in for her session, and I said, hey, we need to really assess this. It sounds like rotator cuff, but let's make sure and let's start your legit rehab protocol. And she was like, yes, totally agree. So, we did some treatments, and first we did an assessment, and all of the things that I did to reassess, to really think and make sure that it is a rotator cuff. It appeared that it truly is a rotator cuff impairment. So it was a little bit hot, per se. So it was aggravated. And we dug into some treatment. We did some joint-specific movement, and then definitely dry needled the musculature surrounding the rotator cuff. And kind of started her shoulder rehab protocol, and not only based from personal experience, but also from other patient experiences. I kind of recalled, like, hey, okay, there's 3 big movements that I think we could instill in your rehab program. And it's a dumbbell external rotation, a dumbbell lower trap raise, and a dumbbell pal raise. And we geared it towards her based on how much weight she's able to withhold. And honestly, we're only starting out at 2.5 pounds. And making sure that she really owns and hones the position and there's no compensations that's going on. So she's like, okay, great. At the end of the treatment, she felt better. Literally the next day in passing, she's like, hey, real quick, do you have some time? Can you go over these movements with me? So a lot of education here, right? So this is another thing that solidifies my thought process when I am working with kind of like these 2 categories of people, I guess. The seasoned individual versus the rookie individual. So I'm like, okay, well, we need a lot more education here. She needs a lot more feedback. She needs a lot more confidence, right, with her movements. So needless to say, this patient was definitely still in this kind of rookie category, and with her thought process that rest was going to fix and help her recover. But resting can only do so much. So when she came into her next follow-up PT session, which was about maybe 2 or 3 weeks later, we reassessed her home exercise program, making sure she's doing everything correctly. We still did some needling to the tissue because I want to still promote some blood flow into the tissue. And a lot of education. She came back to me with some comments, and she was like, I really thought that just by not really doing much and avoiding the movements that seemed to aggravate it would honestly magically make my shoulder feel better. And we talked a lot more on the education aspect, and now she's starting to understand that just by resting is not truly making her shoulder feel better. It's not making her shoulder feel stronger. It's not making her shoulder and the tissue in the joint feel more stable and confident when she gets into some movements. So now we're going to start building some time under tension on the pull-up bar, right? So how to thoughtfully respond to a body's warning signal? First, especially if we're in this rookie category, or something may have happened a first or second time to the shoulder, and that individual kind of still thinks, okay, well, rest and avoid, right? But by no means you're not doing anything directly to the tissue to make it better, to give it some input, to build strength, to build that mind-muscle connection that, okay, we need to really focus in on some prevention purposes. And then slowly getting back into the movements that seem to perhaps have aggravated it. So that is not necessarily the thoughtful way to respond to a warning signal. I think that is more of the approach that you can't, if you're not aware, haven't had this experience, you can't really self-explore, right? Self-explore your own rehab. Sure, you can Dr. Google and Dr. YouTube, assess and look up the best shoulder exercises, but honestly, that's not the true way to approach your specific recovery process, right? Those inputs from Dr. Google, Wikipedia, and YouTube are just there. You're not that person's or that professional healthcare provider's patient. They haven't assessed you. Is it really a rotator cuff issue? Or is it actually coming from the neck? Right? So when we're in this rookie individual category, we can't really self-explore a lot without the knowledge and awareness of, okay, maybe I should seek professional guidance or a professional assessment. And that's where like PT can come in and help that individual. So when we're in this rookie category where you experience something for the first time or second time or possibly third, thinking that rest and avoiding movements is going to make it better, self-exploration won't happen. It can't happen. It's not going to happen appropriately. That is when I think professional guidance needs to be sought out. So this leads to the other aspect. The other type of individual or responder, the seasoned individual. Now this is someone who is pretty well aware of their body. They're well aware that when a pain signal occurs that they might need to alter a movement pattern. So for example, the pull-up. If the pull-up hurts the shoulder, then they might have to put a band on a pull-up bar, sit on the floor, and do a banded pull-down. So they change the load and their position, and they don't try to lift their weight, right? Because when you're doing a pull-up and you have pain in your shoulder or rotator cuff, doing a pull-up, you're lifting your body weight. So then they change the load in the position of themselves by putting a band on the bar, sitting on the floor, and doing a banded lat pull down. Much different stimulus. So these seasoned individuals have had experience in the past where they perhaps maybe do a certain movement and a pain signal, a warning signal happens. They might still be able to do that same movement, but then they alter the amount of weight that they lift. Maybe they go from 95 pounds to 65. Maybe it's a barbell snatch, so they change the load. Maybe it's the volume. Instead of 3 sets of 10, they do 3 sets of 5, right? They cut the volume in half. And then they know that by resting and avoiding movements isn't the way to go, that they remember from the past experience working with a healthcare provider, which could be a PT, chiropractor of some sort, or athletic trainer, that specific rotator cuff movements helped them. So they're going to bring those movements back into their routine and sprinkle them into their perhaps warm up or cool down or in between rest periods of their exercise. And then outside of exercise class, they know that being a little bit more proactive, maybe some self-care treatment. Some self-care treatment might be some gentle stretching. It could be some yoga practice. It could be perhaps some soft tissue work, so cupping. because they were educated on this. So they're able, quote unquote, to turn down the warning signal much faster, more effectively, more efficiently than compared to, I guess, the rookie individual who is very unaware, right? So when it comes to a seasoned individual who has had previous experience with a possible, in this case, example, rotator cuff issue, that they can do a little bit more self-exploration in order to make their shoulder feel better. And then they recall in the past, based on past experience, the things that they did in physical therapy that promoted healing, the things in physical therapy that made their shoulder pain signal significantly decrease. Maybe also adding in some cupping or some soft tissue work or some gentle range of motion movements because they had previous experience. So then they can heal faster and still train around the issue or exercise around the issue. So I think that's two very distinct categories to help you as the listener, if you stuck around this long into the podcast, how to thoughtfully respond to a body's warning signal. And a lot of times this warning signal is a pain signal. All right? And I think, too, that can even go for both individuals, the rookie individual or the seasoned individual, that when they start to feel better, there are times that they might dive into exercise or the CrossFit class or the Burn Boot Camp class head first too fast, thinking, oh, I'm feeling good, everything's moving good, but then we kind of maybe get our ego a little bit too much in the way that, oh, well, the whiteboard or the blackboard or the prescribed weight says 35 pounds for this dumbbell, but I haven't lifted 35 pounds with this specific dumbbell snatch movement in over 3 weeks. I'm going to do it. I'm going to do all 100 reps. I think we need to maybe have two different choices. Maybe we have a 35 pound and perhaps a 25 just in case, right? Because you don't know how your shoulder is going to respond in the moment, after the moment. So it's always, in my eyes, as the physiotherapist, in each category, the seasoned individual or the rookie individual, to do less. Because doing less is actually more. Because when you do less and then you assess yourself 12, 24 hours after and you feel good, then you know that the next time you can do a little bit more. But if you feel worse, then you know doing the less was too much. So then you need to back off even more. That might be a whole nother topic. But I think the biggest thing, like I mentioned before, thoughtfully responding to a body's warning signal, we have to be able to recognize. We have to be aware. If we're not aware and we can't recognize, then we need to seek professional guidance and help. That's where physical therapy can totally step in to keep you in the game, prevent you from being sidelined. Now, as a seasoned individual, you still have to take a step back into this aerial view and kind of be like, okay, when did I feel this tweak? Yeah, it was on the barbell snatch. I had 95 pounds on there. I can still do the barbell snatch, but I know if I were to try 95 pounds, that would not feel good. So I'm going to do 65 pounds, or maybe I'll do 75. Still do the movement, but I'm going to lessen my load. Very, very two different individuals in order to thoughtfully respond to a body's warning signal. For sure. So, big take-home picture. When I work with individuals on how to thoughtfully respond to a body's warning signal, I kind of dump them into these two different categories. The rookie individual, the seasoned individual. Typically with the rookie individual, usually and very commonly, I would 100% vouch for professional guidance, get an assessment, get an evaluation, really see what's going on, get some education, help build your routine, because we know that 100% full rest and full avoidance of movement will not work. In this case, if it's a rotator cuff or shoulder issue, it's not going to make your shoulder any better. It's not going to make your shoulder any more robust. It's not going to build strength, stability, confidence. But as the seasoned individual, you should and have that capability of self-exploration. Recalling from the past, hey, this feels like something I did in the past. I remember what happened. I remember the movements that made me feel better. I remember some of the passive treatment modalities that my physical therapist did with me. I'm going to try them for myself, and if it's not really, really working, I'm going to contact my physio, get on their schedule, and have them kind of work on it. Maybe I need a little change in my home exercise program. But as the seasoned individual, you're able to do a little bit more self-exploration before you really have to seek professional help. All right. Thanks for hanging in there. These are going to be longer podcasts. Again, changing things up. More focus is going to be on the YouTube channel. I will drop the YouTube link. Go ahead and subscribe. Free content coming at your fingertips. And we will see you guys at the next episode of Season 10 of the... That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.